1. When teaching residents to interpret periapical radiographs for endodontic diagnosis, which instructional approach best aligns with adult learning principles? A. Memorization drills. B. Problem-based case analysis. C. Rote recall of image categories. D. Repetition without discussion. 2. An endodontic educator wants to assess higher-order diagnostic reasoning rather than recall. Which evaluation method is most appropriate? A. True-false exam. B. Multiple-choice questions focused on facts. C. Objective structured clinical examination, OSCE. D. Weekly attendance record. 3. During a mentoring session, a candidate struggles with rubber dam isolation for a molar. What is the most effective communication strategy? A. Critique without feedback. B. Demonstrate and invite guided practice. C. Assign a textbook chapter. D. Provide only written instructions. 4. The American Board of Endodontics requires documentation of continuing education. Which principle is emphasized here? A. Regulatory compliance. B. Peer mentoring. C. Patient communication. D. Evaluation bias. 5. A curriculum for board preparation should prioritize which sequence for effective skill mastery? A. Knowledge, skills, application, reflection. B. Reflection, application, skills, knowledge. C. Application, knowledge, reflection, skills. D. Skills, knowledge, reflection, application. 6. A test item asks candidates to identify the most probable cause of post-treatment endodontic disease. What kind of skill is primarily being evaluated? A. Regulatory compliance. B. Analytical reasoning. C. Psychomotor performance. D. Curriculum design. 7. Which mentoring technique best fosters reflective practice in endodontics? A. Asking the mentee to repeat your solution. B. Encouraging self-assessment and case journaling. C. Providing the correct answers directly. D. Requiring memorization of board policies. 8. During board simulation, a resident struggles with stress management. As a mentor, what is the best adult learning-based approach? A. Provide stress reduction resources and guided practice. B. Ignore the issue to build resilience. C. Increase testing pressure. D. Focus only on technical skills. 9. Which evaluation tool best measures psychomotor competency in endodontic access preparation? A. Written test. B. Oral defense. C. Simulation-based skills assessment. D. Peer group discussion. 10. When preparing candidates for oral defense of case presentations, what instructional design principle is most effective? A. Provide structured rehearsal and peer critique. B. Focus solely on lecture delivery. C. Require unsupervised practice. D. Limit exposure to questioning styles. 11. Which communication strategy best supports collaborative learning in an endodontic seminar? A. Open-ended questioning and guided dialogue. B. Instructor monologue. C. Silent reading assignments. D. Rapid-fire factual recall. 12. In developing an endodontic board review course, which curriculum element ensures regulatory compliance? A. Inclusion of HIPAA and patient confidentiality standards. B. More clinical examples. C. Frequent group discussions. D. Memorization of root canal anatomy. 13. An effective mentoring strategy for complex retreatment cases is: A. Encourage mentees to verbalize reasoning before intervening. B. Give step-by-step instructions without input. C. Assign the case to another resident. D. Avoid feedback to reduce stress. 14. The primary goal of formative evaluation in endodontic training is A. To measure learning during instruction and guide improvements. E. To assign final grades only. C. To report scores to regulatory boards. D. To compare student cohorts for ranking. 15. Which approach best ensures validity of an endodontic board-style exam? A. Test items align with board content blueprint. B. Questions reflect personal faculty preferences. C. Use only recall-based questions. D. Include content unrelated to endodontics. 16. When instructing on pulp biology, what strategy supports adult learning retention? A. Linking concepts to clinical decision-making. B. Reciting textbook definitions. C. Assigning rote flashcard drills. D. Minimizing case application. 17. Which mentoring approach builds candidate autonomy in preparation for oral board exams? A. Guided questioning to foster independent reasoning. B. Providing all model answers. C. Restricting candidate questions. D. Memorization-only study plans. 18. The role of regulatory compliance and board certification is best described as A. Ensuring ethical, legal, and professional standards are maintained. E. Improving faculty-student communication only. C. Limiting mentorship opportunities. D. Reducing curriculum scope. 19. Which evaluation format provides the most reliable assessment of diagnostic interpretation in endodontics? A. Structured image-based OSCE station. B. Open-ended group discussion. C. Self-reported study logs. D. Attendance at lectures. 20. A resident presents a case with incomplete clinical notes. As a mentor, what action best reinforces professional accountability? A. Require revision with documentation aligned to regulatory standards. B. Ignore deficiencies to encourage creativity. C. Allow submission as is for speed. D. Provide the notes yourself. 21. When evaluating canal morphology knowledge, which assessment method reflects higher-level reasoning? A. 3D CBCT image interpretation tasks. B. Simple, true, false items. C. Multiple-choice recall of root names. D. Flashcard memorization. 22. Which teaching strategy best supports adult learners preparing for the ABE oral exam? A. Simulated oral questioning with immediate feedback. Passive listening to lectures. C. Silent no copying. D. Multiple choice only practice. 23. Which principle of adult learning is highlighted when candidates are allowed to select their own board case portfolio? A. Autonomy and self-direction. B. Rote memorization. C. External regulation. D. Task avoidance. 24. A board preparation curriculum should include which evaluative feedback cycle? A. Assessment, feedback, reflection, adjustment. B. Assessment, grades, completion. C. Feedback, ignored, retest. D. Reflection, no assessment. 25. The most effective mentoring technique for managing procedural errors during training is A. Immediate corrective feedback with supportive guidance. B. Public criticism in front of peers. C. Ignoring errors to preserve confidence. D. Waiting until final exams to address mistakes. 26. To ensure fairness in board-style assessments, faculty must A. Apply standardized rubrics for scoring. B. Rely on personal judgment without criteria. C. Allow flexibility only for preferred students. D. Avoid structured evaluations. 27. Which adult learning principle is reinforced when residents are encouraged to teach peers about endodontic emergencies? A. Learning by teaching. B. Passive observation. C. Task repetition without reflection. D. Sole reliance on textbooks. 28. What is the most effective evaluation for assessing problem solving during endodontic retreatment planning? A. Case-based simulation exercises. B. Simple recall quizzes. C. Memorization of retreatment instruments. D. Lecture attendance. 29. Communication in case-based learning should prioritize A. Open-ended inquiry and guided reasoning. E. Monologue from faculty only. C. Suppression of resident questions. D. Factual listing without analysis. 30. Which regulatory requirement ensures ethical standards in ABE case submissions? A. Full patient consent and de-identification of records. B. Use of simulated data. C. Submission without documentation. D. Peer review bypass. 31. An evaluation method that best measures integration of biological knowledge with clinical practice is A. Oral defense of case reports. E. Isolated fact recall quizzes. C. Attendance tracking. D. Simple diagram labeling. 32. The mentoring role during board preparation is best described as A. Facilitating reflection, feedback, and guided autonomy. B. Providing answers without explanation. C. Limiting opportunities for questioning. D. Focusing only on error correction. 33. Which curriculum design principle ensures readiness for the American Board of Endodontics exam? A. Alignment of learning objectives, instruction, and assessment with board competencies. B. Exclusive reliance on student preferences. C. Elimination of feedback loops. D. Minimization of case-based instruction.